So I'm actually going to introduce our next speaker, Rebecca Leung, who is, and I hope I said that right, is a public health subject matter expert for her organization, the Hyphen Group. So I want to go ahead and welcome Rebecca.
Hi, Kim. You did say
Hi.
that right. Thank
Oh,
you.
awesome. I'm glad.
that presentation, I mean, reminded me. Ross is like Bill Nye plus Jane Goodall all put together for sharks and sea turtle.
That's the best. That's great description. I was trying to figure out. I was like, who does he remind me of? You're right.
The two of them. Anyway, so it's going to be hard to follow that, particularly with all the background and the clips. But I will try to make it as interesting as possible from a resource
No, I'm thrilled
standpoint.
to hear how you use some data.
I definitely will. So awesome. I'm going to share the screen. Let me pull up my slides. Hang on one second.
Yeah, and then just so you know, we'll collect questions on our end, and when you're done, I'll pop back on and ask the questions to you, so you don't have to worry about that part.
Okay. So let me know if you can see the screen.
You can.
Yep. Can you see the screen? Okay. Now let me see if I can see my part with you guys on it. Okay. So hi, I'm Rebecca Leung, and I'm very happy to be here to share. I can't really call myself an expert like Ross, but I do coach Science Olympiad, and I wish I had learned about moat before a couple of years ago. I was the coach for herpetology and also for building a Wi-Fi extender. So the herpetology part was actually, I had to go get the guide of Peterson's guide to reptiles and try to learn it myself the day before I coach every week. So the way I like to do presentation usually, just in case people have to leave ahead of time, so before I finish, I'll just give you the takeaways. So if you only take away, one thing from my entire presentation is you go through life when you're trying to teach the kids, get them to ask these questions: the when, how, who, what, and why. And then what I try to say to them is like, they'll ask me, what do I do? And I don't really tell them I'm necessarily a health IT practitioner, which is what I am. I do health IT, like electronic health records. We take the information, anonymize it, and we use the information for public health data. So I'm really a practitioner, manager, evangelist, because not a lot of people necessarily want to give you their data. You need to explain to them what you are doing for public health purposes or even for their own purposes. I'm a student. Later on, I'll explain what I am studying right now. Thought leader when I write journals and give public speeches. And we do responses to the government request for proposals. We collaborate with the community for focus groups, etc. So then the one thing, if you really don't have time for any of this, is to use the STEM curriculum or STEM, I guess, competitions to teach your students to be critical thinkers. So that's the takeaway if you don't have time for anything else. So a little bit about, I guess Kim had asked a story. So I am actually more of my background is in music and business, finance to be exact. But I put this slide up because I do a lot of work for Department of Health and Human Services. So CDC, FDA, NIH. I work with them to build the IT infrastructure so that they can fulfill their mission. So a simple one would be like CDC about 15 years ago wanted to find out where the pandemics, and they wanted to know where pandemics might be starting. And we helped them build a website using people's search data. So if people are searching the symptoms of something that could be a flu, etc., that would be a first instance for CDC to know that might be hotspots. And then they will go and contact the providers in that area. So my background is as an undergrad, I was a music and finance major, and then I went on to Silicon Valley before it was actually Silicon Valley. And we started a firm using regression analysis to hedge foreign currency. So at the time, there was no single currency in Europe, and we were helping companies hedge away their foreign currency risk. I wanted to go through this slide a little bit because I don't know whether in your state, in Florida, there is something like a Nova Labs, which is a maker's lab. You can go and build projects. And I'll show you a 3D printer that our group built there. And I do coach for science Olympiad and junior achievement STEM. So essentially there are students who want to start a business in the STEM area, and actually it's STEAM now, whether it's on the science side or in the technology side. And I would say I'm really a lifelong tinkerer. I'm very curious. I mean, just now the presentation was super interesting to me. I have actually so many more questions for him. And then at the end of the day, I always ask the students, for your idea or what you're interested in, does it help? Is it impactful? Is it fun? So I would say my story is really thinking through, are things impactful? Is it fun? And then I try to go into things that I'm passionate about. So portfolio of competencies. So here this is the candlelight holder that was printed by the 3D printer that we made at Nova Labs, which is a maker's lab. So for my line of work, this is really what I need I would say each day. Certifications, you know, as a health IT practitioner, even after you graduate, you get your licenses, they need you to have continuing education. Is really a combination of bioengineering, statistics and research, psychology, neuroscience, and human development. So I would say, even though my background is in music and in business, I probably have colleagues who are all into each of these areas, and we cross-pollinate our ideas. And on each of my projects, and I'll go into a project example towards the latter half of my presentation, how these can be all used. We teach each other the information that is necessary for each of the projects. So I'm probably 1 inch deep on each of these things, but like everybody else, I'm very good at reaching out to my colleagues, or I'm very good at reading up very fast on Google. So the other parts that are probably important, and less so in my necessary daily work, are grant proposal writing, robotic skills, which is necessary when I coach for Lego Robotics or Science Olympiad. But most of all, when I am working with students, usually elementary school or middle school, I try to focus on teaching them life skills, which is more resilience, because there are many times we build a robot and it doesn't pass the course that is necessary for Lego Robotics competition. Grit, being resourceful, there's never enough time for the students to finish their project, and also be critical thinkers, especially nowadays. They will Google something and it's not necessarily, they have to really think about whether it is true. And I want to highlight the holders here because the site that we found, the pattern, is actually a math site. And they have the pattern, this is the pattern of the coral. They use math formulas to get the printer to print it. So we didn't come up with the program ourselves, but we did build the printer. So this is the printer that we built. And you know, it's actually a big chunk of things sitting next to me over here in my office. And most people walk in, they are very curious what it is. But if you take a look at it closer, there are all these wires. So it's actually, it looks impressive. Everybody who comes through say, oh, you guys build a 3D printer. But when you take a close look at it, it's actually pretty simple, but pretty ugly. We didn't try to hide any of the wires. And you can think about it, if anybody who has done icing on a cake before, 3D printer is exactly like that, where you have, is like a pipe, and you put in the program to tell the printer how you want the thing to be printed. And it's always printed from base, so it will print out like a base for whatever you wanted. And then it will move accordingly to the 3 axes. So it's not 2D, so it's like your paper printer, but it's 3D in terms of it will move from bottom to up to print it. And so I always tell my students that there are STEM projects all around. So these are all my, if not current, or at least maybe 1 month ago, STEM projects. So I have a Roomba, and it actually stopped working. And one of the brushes just stopped working. And so I figured I might as well open it up and take a look at the mechanisms behind. So actually I learned a lot about how to make gears work and how the brushes work. So I would call that a STEM project. So I had my children look at it, but I think after I opened the 4th thing, they probably abandoned me and the project. I did clean it out because some of the gears, the dust was getting the gear stuck, and so it did not work. And the dust was also stopping the eye of the so to speak eye of the Roomba not being able to see, and therefore not being able to automatically vacuum the floor. This is my washer, and I had used white vinegar to do some washing, and over time it had rusted. And there's a band that holds the gray gasket here. And so I had looked into it and figured I kind of want to know what the inside of the washer looks like. So that's why I opened it up. So I would say at any point in time, there are different STEM projects. My daughter's class had needed boutonnieres, and I figured I'll find a way to make it for the entire class. So I had to figure out how to get the stems of the flowers to not flop around. So that was another thing that I thought I looked into, what kinds of flowers was the best to do that. And I'm going to use 5 minutes because Kim said you want to know like the details of some of the things like a health IT practitioner would do. So to take 5 minutes on a current project of ours, with the lens of what skills are used. So this is our app. It's called Z Halo, and it's not for public to download, but it is vetted to be downloadable on these 3 platforms. And what it is a project designed to assist seniors to help them function safely and effectively in their living and working environment. So the 3 things that we're looking for Internet of Health things, and I'll explain that in the next slide, is to help monitor them, monitor their daily activities. This is with their consent, of course, assist them with their daily activities and prevent injury and illness. So those are the 3 categories of Internet of Health things for the seniors that we're designing this project. We partnered with Microsoft on this, and so the technology behind this project is all Microsoft, is a Microsoft stack. So these are what we call health wearables. And it's funny that Ross was talking about accelerometers and gyrometers, because we also use that. They're all different kinds of sensors in these consumer health wearables. And like iPad has those monitors, these consumer wearables also have them. So these are what we call health wearables because it does have measurements to help monitor, it could monitor fall. So that absolutely is the gyrometer that he was talking about. And in fact, if you wear it on their hand, we will know if a person has fallen with their hands going up, their hands going down, or if they fell a certain way, because you'll be able to track exactly the fall and how the person fell. So this is for glucose monitoring. And in this case, we were tracking a device for children who have learning disabilities. So these are all what we will call Internet of Health things. And in our short case study, in this case, we have seniors who are diabetic, has heart disease, and maybe living alone in rural areas. So the hospital usually provides the senior with some of these devices, like to detect hypoglycemia, to heart rate patterns, and other vital thresholds, or whether the person has fallen, sleep, and different activities. The goal is to keep them safe and healthy and active, usually at home, because a lot of seniors do not want to move out of their current homes. And the current state of Internet of Health things is pretty siloed. So each device has its own little tracker and screen. So usually the providers and the hospitals do not get all the information from the elderly, or even if the elderly person wants to share it with their family members, like sons and daughters, they're not able to really do that easily. So our project is to create a holistic dashboard, because these devices are converging, and so that the provider or the family members can remotely monitor the alert systems. If, let's say, if the heart rate goes up by more than 20%, then it's going to alert the person. In fact, right now for veterans, we are able to do it for veterans who have who suddenly, let's say, they don't sleep, or their heart rate goes up or go down. It indicates that there's possible usage of misuse of alcohol and drug overdose. So this is for the elderly, but this platform can be used for suicide prevention as well as substance abuse prevention. This is a screenshot of what it looks like. Let's say if the hospital wants to pull up information for one particular device, these are the locations of the device. You see that this says a accelerometer, and it's over a time period. And so these are reports that are filters that the provider can say, look, is it for 1 month, 3 weeks, or just for the last week? And then so if you can think about from our project standpoint, what are the technical skills? It's really all about managing data. So it's the data value chain. So we have to securely connect whatever the the Internet of Health things devices. It's a watch, or is a pad, iPad, etc. And sometimes it's actually a robotic arm. And those are all different platforms, just like Google phone versus a Microsoft phone versus an Apple phone. They're all very different. So one of the challenges and the technical skill is to have the platforms to test and also to build to make sure it works on all different formats. And then we collect the data and we manage and monitor. So for that, the challenges are battery management, battery power management, and also data transfer management. So if the person is always within either wireless or some sort of data exchange mode that we can receive the data, that is always good. But we need to say sometimes people are out of range, and so we need to be able to store the data and then batch it up to the cloud and then send it to wherever, let's say the hospital, etc. We use the data, we will categorize it and try to analyze it, which means the data we get needs to be comparable. And the providers need to be able, they can't just look at a whole bunch of just data. They need to be able to manipulate the data, visualize it. A pie chart, they are able to just drop, just like Excel spreadsheets where you can drop different kinds of pie charts or bar charts to analyze the data. Of course, there's the alert part that we just talked about for the providers or for the family members. And part of it is also there is usually not only one device the person is wearing. There are probably 2 or 3 or 4 devices. You want to integrate all the different data so that the provider is not looking at different dashboards. So the technical skills, I think I did go through a little bit. You'll see that we'll need interoperability, because most of the devices, because they're all made by different companies, they don't really speak to each other. So that is a huge part in our work, that we have to make, so to speak, build bridges for the different devices to talk to each other. And from the platform performance, I mean, just like, you know, Amazon has a very flexible and platform that can deal with a lot of hits at the same time. So that scalability, we need to build it up, have backup plans, have contingency plans, so that we can manage the data load and also the data volume. So scalability and platform performance is very important. Rules-based engines designed for the clinicians, meaning if the doctor says, well, for this patient, we want to put in a rule that it's going to remind the person to drink water or to walk, you know, every hour. Those are rules-based that the Fitbit and the Apple Watch actually has it, that you as a consumer to put in, but clinicians may want to put in their own. There's data integration, we talked about, and data privacy, secure. Those are all aspects that we have to comply with for HIPAA, which is the health privacy data laws that we have to be compliant with. So in our line of business, we have to work with lawyers for compliance as well. Interface and workflow. So this is where we reach out to the community and we get focus groups to work with, in this case, seniors, to ask them, is this something we're aware? Would you remember to charge? Usually we try to make it so that when they take a shower, they just charge it, and then by the time they finish, it's charged enough and it will last until, you know, usually a couple of days, even if they don't remember to charge it. And the workflow is generally on the clinician side. So are they able to include it into the workflow? So for this particular technology, we want to make sure that the rules-based engine is going to be integrated into part of their electronic health record system, that they will remember to go through these rules with their patients. And so the workflow part is very human focused. You will work with the clinician and their patients to include it into the whole solution. So the solution is not only the hardware or the software, it's actually all of it together. And these are the business skills that I know that people generally don't think about, you know, the technical skills and the business skills are both actually technical. So for the business standpoint, it is important, because for us to be able to get money to do the research or get money to progress with the project, we have to be able to show value. And so why is in this particular project important? It's important for public health, it's important for earlier diagnosis, it's important for fewer emergency visits, etc. Those are things that will decrease costs, improve the quality of care, and improve access of care. So just as important as the IT technical skills, the business skills I see as important as well, to be able to get the required funding to improve on these products. And so it's the same slides for the resources. I would encourage you to take a look at like the local universities, if they have research labs, like at George Mason, which I'm now actually getting a master's in social work. I've joined their research lab for the Center for Adaptive Systems of Brain-Body Interactions. So we're building, let's say, a robotic arm for veterans who have their arms amputated. And I would suggest to take a look at Maker's Lab to see if you have anywhere in your area. And there is a USA Science and Engineering Festival. Usually it is in DC, but I think they're trying to take it on the road. And last year and this year it has been remote. So you can sign up for it. And it's kind of like what Ross was doing. So you'll be able to see the different booths, but they do a feature every hour. And it's definitely worth it. It's like 3-4 days in the month of April and May. And again, so this is the slide that I promised. This is the takeaway. If you don't remember anything today, really just is teaching the kids to be critical thinker and think about these questions no matter what they're looking at. And that is the end of my presentation. And if you have any questions, that's my email, and I can send Kim the slides. So
yeah, and I will certainly be emailing out people, emailing out our speakers' contact information just in case they see it or they, later are just like, oh my goodness, I didn't even think of that question.
Sure.
Just to be able to reach out to you. And we do have some questions.
Okay.
I really enjoyed your presentation. I think I've seen Internet of Things presentations previously, but this is, and I've actually seen someone else doing like public health with an app on a phone and collecting that data, but this is a totally different, like a merger of those two things in really fascinating ways. So his first question is, you mentioned that, you were originally a musician. And I know there's a lot, people talk about how there's like a connection between doing well in music and math. I just wanted to ask if you found that to be true for yourself.
For myself, definitely. So I think part of, I can relate to that. So I'm a pianist, a flautist, and I also write music. So there is part of writing music that is totally mathematical. If you dissect Bach's music, it's totally all mathematical. You don't even need to know how, you don't even need to listen. You look at it and it's completely mathematical from a chord progression standpoint, but also from a standpoint of just the feedback you get. So science, what I love about science is if you code something, let's say, and you're wrong, the minute you put it in and you run the program will actually tell you, oh, it's wrong, it won't run. And so the feedback is very similar to being a musician. You play, it doesn't sound right. You know it doesn't sound right. You don't even need to look at it mathematically. You know it doesn't sound right. Now, our ears are also trained for Western music. So when I say it doesn't sound right, it's also, there's a cultural aspect of it if you're writing, different cultural, different types of music. So it's different, but it's definitely true. So I was actually a trader on Wall Street for a while. And I will say to you, so mathematically, it's very important to be that. There are so many people on Wall Street who are also musicians. And so I see that correlation. So not every single thing on Wall Street requires you to be good at math, but it actually does help because it makes you think. It basically just makes you think very quickly. Yeah.
No, I've definitely met people who were math majors in college who went on to financial services because they're really, it's not the math piece, but they are really quick at just being able to see numbers and understand what they mean.
Seeing patterns, which is also music. If you look at the notes, you actually see patterns. But I would say my whole family, they're all swimmers. So I'm the only one that is not exactly the swimmer, or I should say I'm the slowest swimmer. But it's the same feedback, right? They swim, they change their stroke, but then the time comes through right away. So just like all the projects that I'm coaching the students, they get immediate feedback. The robot doesn't work. So then they go like, oh, why? And then they're able to do that. Versus, I think there are other things that take a longer time to give you feedback. Music, robotics actually is immediate feedback. Also food, cooking.
Yes. Although sometimes with baking, you have to wait like an hour.
Oh, yes.
And then you find out you did it wrong.
Yes.
And you're like, oh, fun. 2 hours out of my day.
But I always find a way to make it work. I flattened bread last night and I cut it all out and made it into French toast.
There you go.
It did not rise.
Okay, so then you talked about how, with the accelerometer and all of that, you can tell if someone fell and how they fell. I guess, how do you see those differences?
So on the slide that I showed the screenshot, so those are our reports. So based on the way you fall, so let's say you've slipped and you fell like this, so you'll be able to see the height change. So someone who goes from walking like this and their hand goes like this. So you will see the change within that second, right? It depends on how you run the report. If you suspect, someone fell, you will say, okay, well, we need to know if the person hit their head. Let's say the person passed out, and you'll be able to tell, oh, they fell like this. It's probably true they fell on their head. So
well, especially if they don't stop moving.
Yes, and then that's the other part, right? You can code the program to either call loved one. So if the person stopped moving, I mean, sudden stop moving, not like when you go to bed, stop moving. Yeah. Then you can have the alert. That's where you have the rules-based engine to call either a sponsor or a family, or an alert system in some cases. Yeah.
Oh, awesome. And then the next question is, so what future applications do you see within the Internet of Health things?
So right now what we are doing is using the same platform and a couple of areas. So like I said, suicide prevention. So I'm working with the veterans population, and our country, actually particularly during the COVID times, there is a huge surge in need in mental health. So when I say suicide prevention, it depends on what you want to measure. So part of it is actually prior to even getting the technology to work, we have to figure out with the scientists, what biometrics do we want to measure? So is it sweat? Well, what are we going to look into sweat? Is it going to be, let's say, erratic sleeping? So then what do we mean by erratic sleeping? Is it number of hours, or just sleeping at different times? Or if we have the ability to test people's, let's say, blood sugar. So then do we say, if the blood sugar keeps on going up and down, what is the person doing? And also alcohol. So those are the questions. The technology is there, but then from a biometric standpoint, because you can be wrong, because you can measure all of that, and then people are so different, and then you keep on alerting the sponsor, and it's like, well, nothing's going on with me. I'm just not able to sleep or whatever. So the future of it is actually working with humans to then test out what are the biometrics. The sensors are getting better and better. There is actually one where you can put a tattoo or like a sticker, and it will be able to test your alcohol content in your blood. The government is actually also thinking of the exactly, heart condition, exactly. So the government is also looking at optimal day for the military men and women. So they're doing a sleep study, which they also use these devices to see when to give caffeine pills. So they have to do caffeine pills and not cups of coffee, because they need to control the amount of caffeine in the person. When do they give it? How many hours should they sleep? When do they sleep? What do they match? Because the government also has people working in shifts. So an optimal day. So those are the areas that we're moving into. Drug overdose. So there is one program that actually, if we find a person have a sudden drop, let's say we think that they're overdosing, there is one that it immediately, would jab you with the drug. But I think the FDA will have a lot of problems, because what if you're wrong? You don't want to jab the person with the wrong thing.
Especially with that, because that is. Oof.
Yes, but there are programs that will immediately alert your sponsor or your family, as long as they are within your circumference of 10 minutes. Technically, it should be, you should be okay. So
okay,
yeah.
So to David's question, then you could actually probably make a device that would administer medication if someone with a heart attack, with a heart condition, was actively having a heart attack.
Yes, and in fact, there are companies that are looking into that, but I think the FDA would, I think it's going to have to jump through a lot of hoops. So I would say to you, our program initially, when we did it, we were collecting data that had nothing to do with health. When I say what is it, so the government wanted to know what were the people using their devices. So there's a program for assistive technology. I think the schools also get assistive technology from the state government, which is federally funded. And the government wanted to know when and how they were using these Braille pads or special mouse. And so in that case, we didn't collect any health data. So we had fewer hoops to jump through, because it didn't have to require all the HIPAA stuff. Once you get into the getting HIPAA, then it's a whole different level of compliance. And then if you get into, like, you are actually going to put some medical stuff into people, that is another whole level. So every step of it is going to, that's why you work with institutions. So part of our job is to be evangelists, to convince the Walter Reeds, the NIH of the world to work with us so that we can get through these hoops.
Awesome. And I guess I was, one more question, unless I'll see, but I think one more question is, because you talked about interoperability. And I mean, I guess sort of like, I'm sitting here and assuming that the data is like, looks the same coming from each device. But now that I say that out loud, that sounds a little ridiculous, actually. So I guess I wanted to hear more about, how do you manage that? Like, what are the challenging parts? And how do you get that data to match up?
So when I say interoperability, there are so many levels of interoperability, right? So for example, just even vitamin D levels, I think that is the easiest. So our countries, FDA, NIH have said, vitamin D levels need to be, let's say 200. But then in the UK is actually different. So the alert will be different for each one of those. And then if someone is coming in and they're not looking at it in the same way, or even Celsius and Fahrenheit. So that is the easiest in terms of thinking of interoperability. The data that is tracked is not easily just merged together, just because the measurements are different. And then when I say also interoperability, you have different platforms. So the two different devices can go into different databases, and therefore, when you try to merge the two to have a cohesive, comprehensive picture of this patient or resident or this individual, it just won't go together. So the ugliness is how the sausage is made. We don't want the users to see all of that. So we massage all the data when it comes in, even if you collect it as Celsius. And let's say everybody wants to see it as, we'll make sure that it's being seen as either Fahrenheit, or we'll try to normalize it, so to speak. Yeah.
Okay, awesome. And yeah, that's all the questions we have. Thank you so much for presenting. How interesting. I'm just having seen a couple of different types of presentations that are similar. This is a wildly different field, I think, in terms of, especially when you start thinking about that, the interdisciplinary nature of STEM.
Yes, it is definitely, interdisciplinary is the word. And I would say, I know 1 inch of most things, but my colleagues, but we all know that if we need to tap into each of the areas, we are all critical thinkers. We think like scientists, and therefore we know that each one of us, if we say tomorrow, we need to figure out what FDA now wants because of this coronavirus, we want to test, what can we figure out if someone has the virus like 60 days in advance, 20 days in advance, whatever. We now know that we probably all go into a platform to say, let's go read up on all the journals on coronavirus. So what are all the biometrics? So none of us really know, right? I mean, this is so new, but we all can tap into our resources to say, okay, let's go and read up on all the things about coronavirus. What are all the symptoms? What are all maybes and could be's? And let's narrow it down to say, we have the data, because they have all the, let's say, anonymized Fitbit data. That's how Apple and Fitbit are able to say their app is able to predict a person, because they now have like a lot of data and they now know who has coronavirus. And then, so they just figure out those people, what were the things that are similar from the things that they took from the data. So it's a little backwards, but nonetheless very helpful.
Yeah.
Yeah. So, so we were part of the team to figure out what are the biometrics. So it's similar, like how, if we have to prevent suicide, what are the biometrics that we should look at? And it's fascinating to listen to neuroscientists and psychologists all duke it out. Since I'm not the expert in that area, I find it fascinating.
Oh, I'm sure. I mean, it's probably similar to, I get to sit here and listen to people present about their STEM careers all the time.
Yes.
Which is wildly interesting.
Well, I hope that because I'm not the expert, it just tells everybody that their students do not have to worry if they're not, if they didn't study that in the field, no matter what they study, as long as they're critical thinkers, it is so important.
In person, everyone would clap for you, but we're not.
Thank you for having me. I appreciate it.